Thank you very much, everybody, and we're very pleased that the Chief Constable is with us at our press conference this afternoon. Over this past 9 weeks, you have all made big sacrifices to the way you live your lives. And we recognise people have had to change. And YouGov has found that prior to COVID, only 7% of workers UK-wide say that they worked from home the whole time, with an additional 20% saying they did so occasionally. However, 38% of the pre-crisis workforce were working exclusively from home last week, with another 8% doing so some of the time. The Executive recognises the necessity of getting people back into the workplace and having business functioning again safely, and a substantial amount of work is continuing on that front. The majority of you have heeded the advice in this last couple of months and our appeals to stay at home as much as possible. You have significantly limited your activities in public, you have kept 2 metres apart from each other, and have followed the public advice on cleaning hard surfaces and washing your hands when you've been in contact with others. Those of you who have exhibited COVID-19 symptoms have self-isolated with your family or your housemates, and your selflessness has enabled us to suppress the coronavirus at a time when it threatened to engulf our health services. And while we recognise figures will fluctuate over time and as the virus spreads its way across different regions, NISRA information last week indicated that the Northern Ireland death rate stood at approximately 26 per 100,000, with the figure in England and Wales at 46 and in Scotland at 51. So by flattening that rate of infection, doctors and nurses have been able to devote time and resources to treating those whose lives have been hanging in the balance. And we saw how in parts of Europe in the early days, health services were not able to cope with the excessive demand being placed on them. But such is the severity of COVID-19 for some people that even with that time and those resources, a lot of people have tragically lost their lives, despite the valiant efforts of our health and care staff. Families and friends have had to grieve, not as they should, because of the lockdown, and as they come to terms with their loss, they remain very much in our thoughts. In recent days, the Executive, guided by the scientific and medical advice, have begun to relax some of the restrictions which we had no choice to impose. And restoring these liberties in the face of the deadly virus has been hard won. But we can win back even more freedoms if everyone remains patient, remains disciplined, and remains focused on controlling the rate of infection. In the absence of a vaccine, the threat from coronavirus is no less than it was when we had to implement the lockdown. COVID-19 is still lurking. It thrives when people become complacent, and it spreads when people become blasé about public health advice, and it kills when people start acting as if the threat is no longer with us. So as we head into another bank holiday weekend, those of us in the Executive, in the police and other agencies working hard to limit the spread are keen to reinforce the message that no one in Northern Ireland can afford to be complacent. The majority of us have been fortunate to resist the first wave of COVID-19. Another wave, as we heard from our Chief Scientific Advisor, is expected, but we will also need you to be on your guard against inadvertently triggering spikes. The collective spirit of all in Northern Ireland have shown in holding off the worst ravages of COVID-19 is as vital now as it was 9 weeks ago. And the more disciplined we are in following the public health advice this weekend and the coming weeks, the more it will drive down the R rate. The more we control the R rate, the quicker we can move through the roadmap to recovery and lifting of more restrictions. It's as simple as that. So let's work together to see further relaxations come along as early as we can. Let's stay safe, let's stay disciplined, stay at home as much as possible and follow the 2-metre social distancing rule and hand washing advice. Do not try to preempt the lifting of other restrictions. Your patience and behaviour have driven down the R rate so far, and that is key to the lifting of more restrictions. By being sensible, let us continue to make more progress towards normality that we all want to see returning. Michelle.
Thanks, Arlene, and good afternoon to everybody. Today we've had confirmation that a further 3 people have lost their lives to COVID-19. So we send our condolences to the families and the friends of all those that have sadly died. Earlier this week, we were able to relax some of the restrictions that people have been living by to combat COVID-19. And as we head into the bank holiday weekend, people are naturally going to want to take advantage of those relaxations that we've all been looking forward to for a very long time. It's understandable that after many weeks of living through lockdown, people want to do the things that they've been missing, whether that's a game of golf or going to the garden centre or calling to your mummies for a cup of tea in the back garden. But we need to speak very clearly today about the need to be responsible over this bank holiday weekend. We've said before the coronavirus battle is going to be a partnership effort between ourselves and yourselves. And our success will depend upon everyone being sensible on thinking about others and respecting the social distancing and hygiene advice that's still critical in keeping the virus spread low. I know the vast majority of people just want to do the right thing, but I also know that many people have many questions about what they can and cannot do right now. So I want to address just a few of those questions. So to those people that are shielding and they're asking, can I now go out if I stay apart from others? Unfortunately, at this moment in time, no, you can't. If you've received a letter asking you to shield for 12 weeks, it's because you're at a higher risk of contracting the virus. So the advice for you to shield remains the same. However, you're doing really great at this, and I know it's very, very difficult. We absolutely accept how difficult it is, and I've heard quite often of people struggling with their mental health because they are shielding at home alone. So our message to you is to stay strong, and whenever we continue to do what we're doing, we hope to be able to get to a position as quickly as possible when we are able to lift restrictions that impact on you. To the people that are asking, can I travel a distance to meet people outdoors while observing social distancing? Yes, you can. The changes to the restrictions mean that up to 6 people who aren't members of the same household can meet outdoors while observing social distancing. But we would urge you to be sensible and limit the number of journeys that you're taking and keep them local. To the people that are asking, can I travel for exercise? Yes, you can, but again, please be responsible. Don't travel too far and avoid travelling to places where there are likely to be lots of people where it will be difficult to maintain social distancing. Can I travel on public transport to visit someone outdoors? Again, yes, you can, but you need to observe the social distancing measures in place on public transport and observe good hygiene. You also could consider using a face covering, and it would be a good idea to avoid peak times, especially when key workers are likely to be trying to travel to and from work. To those people that are over 70 who are asking if the relaxations apply to them, yes, they do, unless you have received a shielding letter, in which case you should continue to shield. However, if you're over 70, you are considered to be more vulnerable, so you're advised to be particularly careful about following the social distancing guidelines and good hygiene. So don't put yourself in any additional risk. Can I meet people from other households indoors if we're very careful with social distancing? The Chief Scientific Officer is very clear that no, now is not the time to do that. The medical advice all points to the fact that meeting indoors is still too risky for people now, but we know this is an important issue for people and we're continually keeping that issue under review. We know that families want to be reunited, and as soon as we can get to that point, then we will communicate that with you. We have said before that there is no relaxation of any measure that is without risk. That's why it's so important that our approach is cautious and incremental, and that's why the actions of the public, you at home, are so important. Of course, we don't want to be in the position where we need to reimpose any restrictions at a future point in time, and if we can help avoid that scenario, then that's what we need to do. But the best way we can keep moving forward, the best way we can continue to recover and not move backwards, is by continuing to follow the regulations that are in place. Keep 2 metres away from those that aren't part of your household. Keep washing your hands and observing good hygiene. And if each one of us does those things, we will all come out of this a lot sooner. Thank you. I'll hand over to the Chief Constable.
Well, thank you, First Minister and Deputy First Minister. I think the main thing I'd like to say on behalf of the Police Service is to reinforce the tone set here this afternoon, that we've seen the world around us change, and there is some optimism about how we're working together to beat this virus in the short term. But we've heard a lot about the R factor, and my appeal would be to now use the R word. In other words, act responsibly in what you're doing. So think twice about, do I really need to do this? And if I can't convince you, and if the First Minister can't convince you, or the Deputy First Minister, well then just think, can you go home and look your elderly parents in the eye and say, what I did, was that responsible and was it reasonable? We will continue as a police service to support the health service in their endeavours to keep the incidence of the virus low and falling. You will see a change to the policing style beyond the bank holiday weekend. So we're looking at moving from fighting the virus to fighting crime as we restore neighbourhood policing, but we will still be there to follow our 4 E's approach, particularly in terms of enforcement where we see large gatherings of people that don't heed the guidance and associate outside, be it on the beach, in a park or at a resort, because we have to keep the momentum. This isn't about falling at the last hurdle after the long race and all the endeavour we've put in together to make this a situation where we're seeing some optimism over the horizon. I think that's all I'd like to say at the moment, and happy to take questions.
Thank you.
Ken Reid, UTV. To the First and Deputy First Minister, first of all, how worried are you that your much welcome relaxation of the regulations this week, people are already taking liberties way beyond what you expect? What would you say to them? And to the Chief Constable, how strictly will the regulations now be enforced? And what's your comments, particularly after the remarks by the First Minister yesterday, that dissidents are taking advantage of the situation, the lockdown situation, to try and take control of certain areas?
Thanks, Ken. And I think we made those relaxations in recognition of the commitment of the public of Northern Ireland to working responsibly and working in partnership with us throughout the lockdown. So we want people to continue to do that. And I know people would like us to do more. The reason we're not doing more is because we're relying on medical and scientific advice. We take a step, then we assess the impact that that has had on the virus. And that's what we're doing now. We're looking at where the virus is now, how it is transmitting in the community, and we can only do that when we have a pause to do that, and that's what we're doing at present. And people need to be responsible, as the Chief Constable says. This is not a sprint, it is a marathon. We want to make sure that we continue to suppress the virus. That's the key thing. We started on this journey by saying we needed to suppress the virus and to flatten the curve so that we didn't overwhelm our health service, and we tried to minimise the number of deaths. That's still what we're trying to do, and I hope that people will continue to work with us, because, you know, if they do decide to go beyond the regulations and the restrictions, then actually they're only making it slower in terms of when we can relax more restrictions, and I hope people will realise that that is the case.
I suppose to add to that, I would say that certainly the message to the public is help us to help you. We're trying to save lives. We've said this is a partnership. We all have a part to play in that. We're trying to mitigate as best you can against that second wave, or at least bring down the impact of that. So all of our actions today have ramifications in a week, in 2 weeks, in 3 weeks, and further down the line. So stick with it, go the course, and we actually can, you know, get to a better space and get to the point where we're able to lift other restrictions, which we know people are desperate for, and we want that too. And we've always said that we won't impose these restrictions on people for any longer than necessary, but we'll definitely get there quicker if people continue to heed the public health advice. And I think people in the main have been doing that, but it's natural, I think, that people are in the space that they're in now where, you know, you're out and about a wee bit more. Some people have returned to work, but I think the message would be, Ken, help us to help you in this period.
And if, in terms of the questions you raised, obviously about our policing style and tackling the threat from dissident Republicans, I think the first thing to say is, from the outset, we've had this sort of rule of thumb around the 4 E's, and they still remain valid. And it just gives our officers, when they're making difficult choices sometimes about where to go, when they're dealing with the public who sometimes themselves may have to work out the restrictions and regulations, is what they're doing reasonable and necessary, and to remind people that we will continue to engage, to explain, to encourage, and particularly in relation to large gatherings, to enforce if we have to. I think the other side of the coin is in relation to the specifics of actually our determination to continue our efforts to frustrate and to investigate plots and threats from dissident Republicans. Just like the virus, that threat hasn't gone away, sadly. And our resolve to fight crime and to continue to put resource into that space hasn't changed despite what's been going on in the public place. So I would still appeal to people, if they know about a small minority in their community who are determined to cause harm, determined to wreak havoc and violence, they should turn them into the police.
Can't hear you, Mark.
Can't hear you, Mark.
Sorry, have you got me now?
Yes, we have, yes.
Right, that's better, isn't it? Sorry, Mark Davenport, BBC Northern Ireland. A couple of questions to the First and Deputy First Ministers. First of all, troubles pensions, putting to one side the political argument that you've got with London as to who should be funding them. Are you not now in a very legally vulnerable situation? Because it seems to be that the law actually does put an onus upon you to designate a department to administer that scheme and to provide the funding for the scheme. And also in relation to quarantine, we gather that the UK government is going to say more about quarantine in the next short while. Are you set up now to administer that scheme? And are you concerned about any of the difficulties there might be? Because at the moment it looks like the UK is exempting everyone within the common travel area, but the Irish Republic looks like it's only exempting Northern Ireland. And then finally, a question to the Chief Constable. Chief Constable, we're now in a situation where with the relaxation, doesn't it become a little bit more difficult for your police officers to monitor and enforce the coronavirus regulations, because people have a legitimate reason now to travel around Northern Ireland, potentially to meet up with 5 friends. So will you move away from mounting checks on the roads to simply responding if you get reports of mass gatherings?
So, Mark, in relation to the Troubles pension, it's important, I think, that your listeners and your viewers understand that this pension went through the Westminster Parliament. The regulations were set in Westminster before the Stormont Executive returned in January. I think it was in and around September, October time. Therefore, we take a very clear view in relation to the funding. We are committed to delivering this pension. It's part of the New Decade, New Approach, and therefore the department will be designated in the very near future to deal with these issues. But we do have to deal with the funding. It's quite a lot of money, Mark, and therefore we need to be able to make sure that we can deliver. There is a legitimate expectation. We both expect that. It has to be delivered, and therefore we need to get on and deliver it, and I'm very much committed to that. In terms of the quarantine issue, you will know that this is a reserved matter. It's for the UK Government to implement in terms of UK borders, and we understand there will be an announcement in relation to that later on from the Prime Minister. There has been, of course, conversations with ourselves in relation to that matter, and I understand also with the Republic of Ireland. I do welcome the fact that the common travel area is exempted. I think that that is a generous move by the UK Government, and it's something I hope that the Republic of Ireland Government will also implement as well, so that we can make sure that people can travel across the British Isles.
And can I also say, just in terms of the victims' pension, obviously progress on this issue is a key part of progressing the whole legacy package that was agreed at the Stormont House agreement. We absolutely understand what this is about. This is about restoring dignity. This is about supporting those people that have been both physically and psychologically injured as a result of the conflict. So there are key issues that need to be resolved, and they need to be resolved as quickly as possible to allow this payment to happen. The issue of funding, of course, is one of those issues, and also the issue of the guidelines based on need, but absolutely committed to making sure that we get this payment. I have met many people who've been injured as a result of the conflict, and those people that have been seriously injured, and I've listened intently to their own situations. This needs to be resolved. It's going on for far too long, but clearly there is a need on the British Government in terms of the funding package that's required in order to get this payment put into place.
Mark, thanks for your question, and I think broadly your analysis is absolutely right. We've tried from the outset to have a policing style that reflects the tone and the tempo of the medical risk. So you will see less police officers conducting road checks across the country over this weekend and the bank holiday. And I think the emphasis is about a policing style that looks more like neighbourhood policing now, so that we continue to be visible and to be offering reassurance and crime fighting in our communities, because the work of policing carries on.
Hello, this is a question for the Chief Constable, please. It's Michael McHugh from the Press Association. A bit of an overlap with Mark's question, really. You talked about moving from fighting the virus to fighting crime. What particular elements of crime fighting have suffered during the last 8 weeks? And give me a bit more detail about what exactly officers are going to be doing in the coming period.
Well, actually, it's a really interesting point, because whilst we had the crime figures for the year released a few days ago, which saw over the last 12 months a rise in crime, we've seen a dramatic fall in many types of crime except domestic violence over the period of how we've had to adjust our policing response. So it's not that we've taken our eye off the ball, but just our overriding priority has been to support health colleagues in restricting people's movement to bring the incidence of the disease and therefore the mortality rate down. But that doesn't mean that behind the scenes, while you've seen a lot of police officers on the streets conducting roadside checks to see where people are going and moving and helping support that endeavour, behind the scenes we've still had detectives investigating crime, fighting terrorism, and a particular area of emphasis has been where, for example, we've been hunting down, for want of a better word, our most high-risk offenders, particularly in the space of domestic violence, where we've been looking at those people that pose the most risk to their partners and making sure that our response has been robust and resolute. But inevitably now, you can see as some of the emphasis changes, we need to stay one step ahead of crime, so that there is, I think, frankly, a risk if the economy doesn't pick up soon, that there's a likely rise in acquisitive crime, burglary, theft, robbery, and we need to have people back out on the streets in our neighbourhoods to get the information and intelligence to make sure that we're on the front foot in terms of stopping that likely rise in crime if we don't.
Good afternoon, everybody. Maurice Fitzmaurice here from Belfast Live on the Mirror. My question would be primarily at the First and Deputy First Minister. It's regarding the correlation that one exists between the capacity for testing and tracing and the speed at which the lockdown is being relaxed. The point I'm getting at is that there has been a suggestion that as the lockdown is relaxed, clusters will occur, but if capacity to test and trace is sufficient, those clusters can be isolated and dealt with. So I suppose to refine my question, it would be, would you be more comfortable to speed up the relaxation of the lockdown, if you like, if testing and tracing capacity was greater than it currently is? Thank you.
Well, Maurice, I think if you look at our roadmap, a key part of that is the testing strategy and the fact that we need to have that contact tracing in place so that we can trace everyone who is in contact or up to a number of contacts. If we find out someone has the virus, then we're able to trace that and see who they've been in contact with. Pleased to say that the Department of Health has started that this week. They started it on Monday. They have a number of people, I think it's 58 people already doing the tracing of individuals. So I think that we are ahead of the game in terms of our contact tracing. Of course, we need to continue to grow the capacity of that, because you're right, once we move to the next step in our roadmap, then we have to make sure that we have enough contact tracers in place to trace everybody who has it so that we can move forward. So it's an integral part of our roadmap. It absolutely is, and the Department of Health are very much aware of that and have been working with colleagues in the Republic of Ireland and across the United Kingdom to make sure that we have the right mechanisms in place to do all of that.
Yes, Maurice, the test, trace and isolate policy is a key component part to the pathway to recovery. We've written that large into our document, so for us it's always going to be guided by the science in terms of when we can lift restrictions, the impact of the disease spread. So when we monitor how lifting certain easements, what that does. We don't know what the immediate impact is. It takes us 14 days to 3 weeks before you can actually properly judge those things. But certainly the cornerstone of the pathway to recovery is having that full test, trace and isolate policy in place and have it up and running. I welcome the fact that there has been improvements, but we have to continue to ramp up the capacity to test and then also to follow through. I think that the Health Minister has said this week that all those people that have tested positive this week have been traced, all their contacts have been traced, and that's obviously a very good thing. But obviously as more people are tested, then we need to make sure that the capacity is there to also follow up on the contacts. I think it's an average, it's about 30 people per person tested positive would have to be followed up upon. So you can see the resource that would need to be put into that to make sure it happens when more and more people are being tested, which is obviously right and proper that they are.
Bean Archer, Irish News. This is for the First Minister and Deputy First Minister. You had a lot of criticism for closing down after other regions and also for opening up again later. But a benefit of that is that you have had more time to actually plan for post-lockdown. What practical changes will people see when they go to hospitals for appointments and treatments and operations? And children, when they finally return to school, you know, what will waiting rooms look like? What will classrooms look like? And how much more space will be needed? If that's not something you can tell us now, could you give us an indication of when you'll be able to give us those kind of details?
So
I'm sorry, if you have, have you had to review or revoke any fines issued on the COVID legislation following ACC Todd's review of guidance?
Okay, so do you want to go for it?
I was just going to say, on the issue of hospitals, the Health Minister has informed us that he is planning for how you re-engage, bring people back in, for example, for screening, for their normal hospital appointments, all those things that were deferred because of the response to COVID. And we want to quickly get back to that. What shape that takes yet, I couldn't paint for you today, Bimby, but I think that clearly we will see that strategy unfolded over the course of the next number of weeks. But I think that there is probably lessons in all of this as well, in the period that we've been through, how you can deliver care in different way in some areas. So I think that we also need to take this as a chance to learn. Telemedicine, all those things that have been effectively used right now, how can that play more of a role in the future? But I think over the course of the weeks and months ahead, you'll have a better picture of what the health service looks like on the other side of this. And on schools, it's a similar piece. The Education Minister obviously made an announcement yesterday that the schools won't open again until the new academic year, so the end of August, start of September. But key to that process of opening up has to be engagement with stakeholders, and he has committed to go and do that piece of work. So work with our teaching unions, work with the stakeholders about what does school look like in September, how are schools going to manage being able to bring children in and then have effective social distancing in place. So I think there's a challenging road ahead for our schools and for our teachers and for our parents who will be sitting today wanting to know what does school look like for my child in September. And I mean, that's a very natural instinct, and I hope that over the course of the weeks ahead, the Education Minister will be able to paint a better picture after the stakeholder engagement which he is currently involved in.
So I think just to add to that, it's always easier to turn something on than to plan to come back out again. And there are many different sectors who are working with our ministers at present, trying to plan that step-by-step approach to coming back into the new normal. We will pick up some experiences of the lockdown, working from home, which I referenced in my remarks, the fact that there's so many people working at home. What does that look like in the future? Can people have the option of working at home? Do they want the option of working at home? Some people may not. So there's the whole economic piece. Of course, that is linked in with the education piece, with childcare. So a lot of the pieces have to interlock with each other, and that's the sort of work that is going on in all of the departments at present. And we have to make sure that we do it in a way that is clear, but is also safe, and that we make sure that our people understand. So that's why we want to communicate with people. It's why we want a partnership approach to all of this, Bimby. So I think it is important that we continue to have the conversation with the stakeholders, with the unions, with everybody in society, so that we can take that step by step out, take the learning from where we've been, and also make sure that we keep everybody safe.
I think the final thing is in relation to your question about reviewing and overturning fines. I think it's about putting this in perspective. I think if you think about just over 1,000 times we've had to use our enforcement powers in a variety of different ways to actually help us police these restrictions across a population just shy of 2 million people. So largely the message has been about cooperation, and it's also been about pragmatism and common sense on behalf of the officers that we've put into the front line to support the health endeavours. So I'd like to pay my tribute to the public for that sense of cooperation and patience, and also to the officers who've stepped into that space and the staff that support them. I think the other thing in terms of reassurance is you may have seen that only recently myself and the Commissioner of the Garda have announced our own review, which will be quite wide-ranging, looking at a whole raft of issues, whether it's how we've used legislation, used our sort of combined efforts to see where we can learn quickly, and we'll be bringing the results of that review in the next few months so that we can see there's due regard and scrutiny when we've had to use powers to help the health endeavour.